Around the globe, people are adjusting to major life changes, helping to fight the spread of the coronavirus. Many of you probably find yourselves at home and hopefully are practicing social distancing. We are doing the same here, too, in the studio. Seated 6 feet away from me is Dr. Richard Besser, former acting director of the CDC during the swine flu pandemic. Many of you remember him, of course, from his time here at ABC News. He is now president and chief executive of the Robert Wood Johnson Foundation. Dr. Besser, what do we know? First of all, thank you for being here.
Pleasure.
What do we know about the spread of coronavirus?
Well, we know that it's a pandemic, and what that means is the expectation is the infection will spread around the globe. It's going to hit every country. It's likely to hit every community. But what that means is that it's not all at once. You know, coronavirus is spreading at different times in different places. So we saw it hit China and Singapore and Korea and Italy and then Seattle. So what we're seeing in Seattle isn't exactly what we're seeing in New York or Miami or in Dallas. And what's important to remember about a pandemic is that it's a series of local outbreaks occurring at different times, and you need to respond to it based on what's going on in your community.
And what's the special magic number about 6 feet, that distance?
Yeah, so different types of infections spread in different ways, and this is one that is felt to spread mainly through respiratory droplets. So when you speak or when you sneeze or when you cough, you spray out into the air little drops of moisture. And in that moisture is the virus. It goes to ground very quickly. So if you're more than 6 feet apart and you're talking and you're sick or you sneeze and you're sick, the particles should hit the ground before they get to another person.
How are people tracing these contagions?
Well, you know, it's challenging. You know, with certain infections, something like SARS or Ebola, you can see who's sick, and people don't spread the infection until they're sick. With this infection, right now what we think is that as many as 80% of people have either no symptoms or mild symptoms. And so you could be with someone who looks perfectly well and feels perfectly well who has this. So from a public health perspective, what you want to be able to do is look across the community by testing people who may not be sick as well as those who are, and see if it's spreading there, as well as testing people who are sick and seeing, well, is it the flu, is it coronavirus, or something else?
You know, here in New York, we've been seeing this debate between the mayor, who's saying that we may decide to have people have a mandatory stay inside your house. The governor is saying we're not going to do that. The world, according to Dr. Richard Besser, what's the right thing to do?
You know, when I think back to H1N1 swine flu, when I was running the CDC response, we came up with all kinds of things for people to do. We knew the best public health science, and we said, do these things. And we didn't think as much about who's able to do these things and who can't. I'm very conscious of that now, and there are so many people in America, millions and millions of people who live paycheck to paycheck. And you tell people to not work. For some people, that means no food on the table, no rent. Right. It means that they're not going to be able to do those things in life. And we have to pay attention to that. You know, rural communities, communities of color get hit really, really hard when you do that. When the time is right, I think you do that. But you don't want to do it too soon because people are going to suffer.
In a recent Washington Post op-ed that you wrote, you talked about the benefit of potentially giving money, giving out checks monthly to Americans. The administration says that they're considering doing that. What's the benefit of that in a healthcare crisis?
Well, in America right now, there are only 10 states in the District of Columbia that mandate sick leave. So for most people in America, if you don't work, you don't get paid. And if you don't get paid, you can't do those things that you need to do. If you're giving people a check, you're encouraging them to do the right thing, which means stay home, stay with your family, take care of those people around you, and don't go out and potentially get infected and bring it home. People want to do the right thing. We need to make sure that we're helping them to do that.
You mentioned H1N1 just a little while ago. What would you say is the biggest lesson that you learned?
Well, there are a number of lessons, but I think that the more straightforward you are with the public, the more transparent you are, the more you're going to engender trust. What we did at the CDC was we told people what we knew when we knew it, what we didn't know, and what we were doing to get answers. And we're not hearing from them now. They've been sidelined. And I want to know what the best science, public health scientists in the world are doing. I talk to them, so I know, and they're studying everything going on around the globe. They want to learn from Italy and China and other countries that have seen this, so we can apply it here and be safer. And I think people would feel comforted to know that we're learning from what's going on in real time.
And Because you are having those conversations, what are you telling your own family?
Well, I'm telling my own family, we have two kids who are in their 20s. I'm telling them that, thankfully, they are very, very low risk of having serious illness. But they have an important role to play in protecting my parents who are in their 90s. So, I'm being honest with them. I'm not trying to scare them that they're at great risk of severe illness, because they're not. And if you tell people information that's not true, in the end, they're not going to listen to anything you have to say. But I'm also trying to let them know the important role they have to play here.
Dr. Richard Besser, thank you so much for your time. We appreciate it.
It's a real pleasure.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.